The spectrum of neurosurgery, as I understand it, I'm not a neurosurgeon. I mean, I'm not that qualified as a neurosurgeon, but the spectrum of neurosurgery is either trauma, where there's an injury, okay, or there is malignancies, or there are congenital deformities, okay, or there are functional deformities. So this guitar thing that you are talking about comes under functional neurosurgery, where there is a disturbance in the electrical activity of the brain. And the brain is a very complex organ. It's one of the most complex organs in the body. And when there is this electrical disturbance, then patients get either they get spasticity of their muscles, or they get twitching of the muscles. There is a abnormal movement of the muscles. They get cramps. Okay, and many a times it's in the peripheral limbs, it's in the upper extremities, it's in the lower extremities. They can't walk, they can't lift a glass of water and drink water, they can't hold a pen, and they cannot sign. So they are actually devastated with this problem, because they are young patients. Okay, there's no apparent cure, and that disease is not going to kill this person. So if he is not treated, this person will still lead his normal lifespan, okay, but the quality of life will be so poor that he will be dependent on somebody else to assist him, even for basic necessities, for day to day necessities in his life, like putting on a button, or drinking water, or holding a fork and a knife in his hand, holding a spoon in his hand. And that would cause so much psychological trauma to the patient. It will disturb his whole life, you see. So, in the terms of functional neurosurgery, they have a system. They have a system where they can actually go into the brain on an awake individual and target that particular area in terms of micromillimeters, because if you go out of that micromillimeter, you will be targeting another area of the brain which may cause more problems than resolve problems. Okay, so it's called stereotactic surgery, and it's not very common in India. It's not very common in India. It's not common in India because, number one, it's expensive. Okay. Number two, the expertise is not there. Number three, not very many surgeons actually want to get into this area. They want to get into more glamorous, surgeries and things like that. Not realizing that this itself is such a glamorous thing that when a patient is sitting in the operation theater, okay, now he's got writer's camp, or he's got a guitar problem. This man was a guitarist and he was not able to earn his living, and this surgery is live awake surgery, because once you hit the right target in the brain, and now you're going to burn the circuits of that target, everything is going to come back to normal. So it's spontaneous. Okay, it's spontaneous. The patient responds back to you, to the surgeon, that look, I had this problem. I think I'm resolved of this problem. But if he was under anesthesia, if he was unconscious, you won't know where you're going inside the brain, although you can image it, and the patient cannot respond back to you. So we did this one surgery, and Dr. Sharan has had a special training in this area. Number one, he's got a special interest in this area, and then he took the initiative of going all the way to Japan, which is the seat of learning for this particular type of neurosurgery. Okay, and he spent some time there with world-renowned functional neurosurgeons, and he got trained there, and he came back, and so we invested in infrastructure for him, and he started doing these neurosurgeries with great results, with absolutely great results. So not very many people have seen that you have that you have a person being operated on, his brain sitting up and looking and talking to you. That itself, to a layman, appears to be, hey, what's going on here? So they all think that brain surgeries are very, all patients are unconscious, they're on ventilators, they're in the ICU, and they get bed sores, and they get all sorts of, things. But nothing of the kind here. Okay. So it was very fascinating. It was fascinating to all of us as well. I mean, I had never seen anything like that in my life. Okay, I've spent 50 years in the medical profession, but I had not seen anything like that in my life. So it became very popular, and we consciously kept the pricing down so that because we know when a patient comes to us with this problem, he comes to us when he's not able to earn his own money. He comes to us after his relatives have spent a lot of money trying to treat him, on conservative lines or some, Ayurveda or some, this sort of non-conventional treatment. And pretty much he doesn't really have the financial resources. So he may shy away even from coming to you because he doesn't have the resources, and we don't have any sort of a foundation or something like that which we can fund. So we try to keep the prices down, and even Dr. Sharan kept his prices down, and I think it took off in a good way. I mean, it was good publicity. It went on to the BBC and all sorts of things. But the results were very. I'm sure you must have seen some videos, okay, and I think you should publicize those videos because that gives you the before and after scenario of the patient. And obviously, when you speak to a patient of that nature, he's going to come back to you with a lot of positive vibes. I was not able to do anything. I mean, I was just crippled for life, and I'm back to normalcy. So, I mean, that's a great thing. That's a great thing. After all, I mean, only God can cure 100%, but whatever they can do, I mean, they're human beings. They try to do whatever they can, and it's service to the society. It's service to our patients.